Dr. Shira Doron is hospital epidemiologist at Tufts Medical Center, joining us tonight. Thank you for being with us once again. So it's Memorial Day weekend. We did see significant traffic heading down to the Cave today. People want to get out. So let's talk about what precautions they need to take and what's at stake if they do.
Yeah, I mean, everyone is getting quarantine fatigue, and when the weather looks this wonderful, it is important for our mental and physical health to get outside and enjoy it. But we do need to remember that the governor's measures are in place for a very important reason: to slow the transmission of the virus so that the hospitals don't become overwhelmed and so there isn't unnecessary death as a result. So what we need to keep doing is stay at least 6 feet away from people with whom you do not live. Keep your mouth and nose covered when you're in public. Clean your hands if you've touched something that other people have been touching, and don't touch your face.
Easy things we can all do. What about this one? Kids might want to go swimming. Is there a transmission risk at pools or from swimming? Do we know that?
Yeah, probably not from the water itself. The way pools are maintained, they're usually pretty good at keeping viruses and bacteria from growing in them. But pools, beaches, those are all places where it can be hard to maintain that 6 feet of distance. So you just have to be very vigilant about that.
Okay, so let's talk about a study The Lancet, a medical journal, just published about hydroxychloroquine, the anti-malaria drug that President Trump says he is now taking to prevent becoming infected. This study involved a lot of people, 96,000 hospitalized COVID-19 patients. Can you tell us what this found?
Yeah, so this was an analysis of a registry of data from 671 hospitals from around the globe. And what they found was that patients who received hydroxychloroquine, when compared to those who did not, were almost 35% more likely to die. And they were more than twice as likely to have cardiac abnormalities, abnormal heart rhythms, actually.
It sounds really concerning, but we know that this is used to treat some patients for lupus, rheumatoid arthritis. Have we found that those patients already taking it, were they still infected with COVID-19? Was there any preventive or protective measure for those patients?
Yeah, so far it does seem like patients who already take hydroxychloroquine still can get COVID-19. Now, there are ongoing clinical trials evaluating whether taking hydroxychloroquine can prevent acquisition of COVID-19, but it's not likely to be a magic bullet, and even as prevention would be expected to cause some of the cardiac or heart rhythm abnormalities that were seen in that study, and which we have seen in patients treated with this medication in Boston.
Concerns to know about. All right, Dr. Shira Doron, thank you so much for your time. We really appreciate it.